चैप्टर नंबर 33 सेरिब्रोस्पाइनल फ्लूइड एनालिसिस। आज हम लोग समझेंगे सेरिब्रोस्पाइनल फ्लूइड का एनालिसिस कैसे किया जाता है और इससे क्या क्या जानकारी मिलती है और ये कब नेसेसरी होता है। तो चलिए शुरू करते हैं। सेरिब्रोस्पाइनल फ्लूइड CSF इज फॉर्म्ड इन लैटरल वर्टिकल्स ऑफ ब्रेन बाय कोरॉइड्स प्लेक्सिस। ये कहाँ बनता है? तो लैटरल वेंट्रिकल्स में बनता है, ब्रेन में, by choroidal plexus which circulates through third ventricle and joins the fluid formed in fourth ventricles. It then passes into subarachnoid space of brain and a spinal cord. In the subarachnoid space there are villi surrounding blood vessels entering and leaving the brain and a spinal cord. Through the villi, some blood cells and protein enters CSF and water and other constituents re-enter blood. Thus, a circulation of CSF is maintained. CSF provides route for removing waste material from nervous tissue. As there are no lymphatic channels in brain and a spinal cord. The CSF also acts as a cushion against mechanical shock. CSF is formed by active secretion and therefore concentrations of its constituents are different from those of blood. It has lower sugar and protein levels but higher chloride level. It has lower sugar and protein levels but higher chloride level. When permeability of chlorides plexus and subarachnoid villi is affected, as in infection of the brain, protein increases in CSF, but sugar may decrease due to presence of microorganisms and large number of blood cells. Usually CSF is obtained by lumbar puncture for analysis. Sometimes it is collected from subdural space at the base of the brain. The analysis includes recording of pressure of CSF at the time of collection, its color, presence of coagulum and transparency. Occasionally its specific gravity and pH are also noted. Chemical analysis is usually done for protein, sugar and chloride. Sometimes sodium, potassium and carbonate SiO3 are also required to be measured. Microscopic examination is done to see if leukocytes and RBC are present. Whenever required, microbiological examination is also done. In normal state, CSF is clear, colorless and without any coagulum. Its specific gravity lies between 1.006 and 1.008. It may look turbid due to presence of leukocyte and RBC, as in the inflammation of meninges. Coagulum may be present when there is presence of fibrinogen, as seen in tubercular meningitis. It may appear reddish or frankly hemorrhagic in inflammation of meninges or subdural bleeding. Normal CSF values: opening pressure 50 to 200 mm H2O CSF. Colorless, turbidity, crystal clear, mononuclear cells less than 5 per millimeter cube, polymorphonuclear leukocytes 0. Total protein 22 to 38 mg per deciliter. Glucose 60 to 80% of blood glucose. Colorless होगा, turbidity crystal clear, mononuclear cells less than 5 per millimeter cube, polymorphonuclear leukocyte 0. Total protein 22 से 38 mg per deciliter. Glucose 60 to 80% of blood glucose. Albumin is the chief protein in CSF, but during acute inflammation, albumin जो है चीफ प्रोटीन जो है CSF में होता है, बट ड्यूरिंग एक्यूट इन्फ्लामेशन ऑफ meninges, globulin and fibrinogen will also appear besides increase in albumin level. In normal CSF, 20 to 45 mg of protein is present in 100 ml. In normal CSF, 20 to 45 mg of protein is present in 100 ml. The concentration of sugar in normal state varies between 45 to 80 mg per 100 ml. It would be higher in diabetic patients. In pyogenic meningitis, glucose may drop even to 0 level, but in tubercular meningitis, it usually does not drop much. Chloride concentration in normal CSF lies between 120 to 126 milliequivalent per liter, which obviously is higher than plasma chloride level 100 to 107 milliequivalent per liter. If plasma chloride decreases, it will be reflected in CSF also. Chloride concentration is lower than normal in tubercular meningitis and also in conditions where plasma chloride is lower, as in excessive vomiting. Table 33, CSF value in different types of meningitis. बैक्टीरियल मेनिंजाइटिस, न्यूट्रोफिल बैक्टीरियल मेनिंजाइटिस में 10 मिलियन to 1000 मिलियन है ना, बट में भी नॉर्मल. लिम्फोसाइट यूजुअली लेस देन 100. बायोकेमिस्ट्री प्रोटीन ग्रेटर देन 1.0 बट में भी नॉर्मल. ग्लूकोज CSF इज टू ब्लड रेशियो लेस देन 0.4 बट में भी नॉर्मल. बैक्टीरियल मेनिंजाइटिस में ऐसा हो सकता है. न्यूट्रोफिल नॉर्मल आ सकता है, प्रोटीन नॉर्मल आ सकता है, ग्लूकोज नॉर्मल आ सकता है. लिम्फोसाइट जो है लेस देन 100 लाख. वायरल मेनिंजाइटिस यूजुअली लेस देन 100 लाख. न्यूट्रोफिल लेस देन 100 लाख. लिम्फोसाइट 10 to 1000 but may be normal. Protein 0.4 to 1 but may be normal. Glucose usually normal. Viral meningitis में. TB meningitis usually less than 100. Lymphocytes 50 to 1000 but may be normal. Protein 1 to 5 but may be normal. Glucose less than 0.3 but may be normal. Experiments. In the absence of flexible CSF, a synthetic CSF can be prepared from class exercise. For class exercise, the CSF should contain glucose 60 mg per deciliter, albumin 50 mg per deciliter, chloride 100 mg per liter, and a few drops of blood. Microscopic examination examine a drop of CSF for the presence of leukocytes and erythrocytes. CSF can be diluted 20 times and then counted using hemocytometer for the number of leukocytes per centimeter. Normally 0 to 4 leukocytes per centimeter. Mainly lymphocytes are seen. In pyogenic meningitis, the number may go up to 2000 per centimeter, and polymorphs will be mostly seen. In tubercular and viral meningitis, the predominant cells is lymphocytes. Estimation of glucose in CSF. Glucose can be estimated by the GOT-POT methods described for blood. CSF should be collected in fluoride irradiated tube. Glucose content decreases markedly in pyogenic meningitis. May decrease slightly in tubercular meningitis, but does not change in viral meningitis. Glucose can be estimated by the GOT-POT methods described for blood. Glucose can be estimated by the GOT-POT methods described for blood. CSF should be collected in fluoride irradiated tube. Glucose content decreases markedly in pyogenic meningitis. Glucose content decreases markedly in pyogenic meningitis. May decrease slightly in tubercular meningitis, but does not change in viral meningitis. Glucose can be estimated by GOT-POT method described for blood. CSF should be collected in fluoride irradiated tube. Glucose content decreases markedly in pyogenic meningitis. May decrease slightly in tubercular meningitis, but does not change in viral meningitis. Estimation of protein. CSF protein can be estimated by different methods. The older turbidimetric method using trichloroacetic acid and commonly used pyrogallol red method. Pyrogallol red method principle: protein present in the sample forms a red complex with pyrogallol red molybdate. The absorbance is directly proportional to the protein concentration. Reagent preparation. The reagent provided in the assay kit are ready to use. Pyrogallol red 60 micromole per liter, sodium molybdate 40 micromole per liter, standard 1100 mg per liter. Procedure: bring reagent to room temperature before proceeding for testing. Prepare into label test tubes. ब्लैंक स्टैंडर्ड टेस्ट लगाना. रिएजेंट 1 ml सब में लेना. डिस्टिल वाटर 20 माइक्रोलीटर ब्लैंक में. स्टैंडर्ड में 20 माइक्रोलीटर स्टैंडर्ड और सैंपल CSF 20 माइक्रोलीटर टेस्ट में. Mix thoroughly and incubate the tube for 10 minutes in 37 degrees Celsius. After completion of incubation, measure the absorbance of the standard and sample against blank at 600 nanometer. Total protein milligram per liter. Absorbance of sample upon absorbance of a standard into value of a standard. Reference range: cerebrospinal fluid 20 to 40 mg per liter. Turbidimetric method using TCA. Turbidimetric method for this estimation is most convenient and is widely used. Turbidimetric method using TCA. Turbidimetric method for this estimation is most convenient and is used widely in all types of meningitis. Protein is higher than normal, very high in pyogenic, moderate in tubercular and viral meningitis, but may be normal in other conditions. Reagent: trichloroacetic acid, 3.5% volume, weight by volume. Trichloroacetic acid is at this concentration has the advantage that both albumin and globulin produce equal turbidity, so that variation in composition of the spinal fluid protein do not cause error. A stock protein standard: a pooled blood serum whose protein has been determined by a standard method serves as the best standard. Protein concentration in the serum should be applied adjusted to 5 mg per deciliter by suitably diluting it with normal saline and aliquoted into several small tubes, each containing 0.5 ml, stoppered well and kept frozen in a refrigerator. A pooled blood serum whose protein has been determined by a standard method serves as the best standard. Protein concentration in the serum should be adjusted to 5 gram per deciliter by suitably diluting it with normal saline and aliquoted into several small tubes, each containing 0.5 ml, stoppered well and kept frozen in a refrigerator. Otherwise, a stock solution of albumin should be prepared by dissolving 500 mg of pure crystalline albumin in 100 ml normal saline and kept frozen in 0.5 ml aliquots as described above. C. Working protein standard 50 mg per deciliter. Take out a tube of stock protein standard and make a dilution with normal saline to give a concentration of 50 mg per cent. Normal saline 0.9% NaCl. Procedure: take 3 test tubes and mark them as BST for blank standard and test. Blank में normal saline 1 ml और trichloroacetic acid 4 ml. टेस्ट में CSF 1 ml और trichloroacetic acid 4 ml. स्टैंडर्ड में भी 4 ml ट्राइक्लोरोएसिटिक एसिड और 1 ml वर्किंग स्टैंडर्ड. Shake each tube to mix and leave them to stand in water bath at 37 degrees Celsius for exact 10 minutes and read absorbance of all tubes in a photometer at 450 nanometer transmission or using buffer blue filter. If there is heavy turbidity in tube T, dilute the CSF suitably and with saline to get turbidity in the range of a standard but not more than twice that of a standard. While calculating, remember to multiply the results by the factor of dilution. Calculation: milligram protein per 100 ml CSF. T minus P plus minus P into 50. 50 milligram is the concentration in standard
Note a calibration graph can be prepared from time to time for ready calculation. Estimation of chloride principle: when mercury nitrate is added to the chloride solution in presence of an indicator diphenyl carbazone, unionized mercury chloride is formed. The red color formed by mercury nitrate with the indicator vanishes immediately when there is presence of excess of ionized chloride. The first excess drop of mercury chloride, which changes the color to red to bright purple, indicates endpoint. Reagents: indicator 100 mg diphenyl carbazone per 100 ml ethyl alcohol. Store in a brown dropper bottle in refrigerator. Prepare fresh every month. Mercury nitrate solution: dissolve 3 gram mercury nitrate in 500 ml deionized or double distilled water. Add to it 2 normal nitric acid and make to 1 liter with water. Concentration: nitric acid of specific gravity 1.42 is about 16 normal. 126 ml of nitric acid per liter makes 2 normal solution. A standard chloride solution: 10 ml equivalent per liter. 585 mg of pure dry sodium chloride per liter of deionized or double distilled water. Procedure: take 2 ml distilled water in 225 ml conical flask. Mark T and S for to T at 0.2 ml CSF and to S add 0.2 ml chloride. Standard: add 8 to 4 drops of indicator to each and titrate with mercury nitrate solution from the 2 ml microburette till a violet or red color appears. Sometimes red color may appear with first drop, but that will disappear as titration proceeds. Note the volume of mercury nitrate required to titrate CSF and standard chloride. Let it be T and S ml for CSF and standard repetition standard respectively. Calculation: ml equivalent per liter chloride percent in CSF T upon S into 10. Question and answer. What is the significance of increased protein content of CSF? Main source of increase of protein in CSF is infection in brain, as in meningitis, encephalitis or myelitis. Rise of protein is also seen in case of tumor of brain hemorrhage, which will be confirmed by its color and or presence of RBC. What information is gained by CSF glucose estimation? What information is derived from low CSF chloride? Chloride level in CSF decreases in meningitis, more prominently in tuberculous meningitis. तो फ्रेंड्स, ये चैप्टर कंप्लीट हो चुका है. नेक्स्ट चैप्टर है चैप्टर नंबर 34, एस्टिमेशन ऑफ सीरम इलेक्ट्रोलाइट. इसे हम लोग नेक्स्ट वीडियो में कवर करेंगे. तब तक के लिए बाय. हंसते रहिए, मुस्कुराते रहिए और पढ़ाई करते रहिए. बाय बाय. थैंक यू.